Dental implants have a success rate over 95% if they're done under the right protocol. The problem is not the technology, is when they get oversimplified. This applies to patients that have already implants and for those considering them. What are the real causes of implant failure? This is a question you should ask if you're thinking about getting dental implants, and there might be multiple causes. One of the most important factors, it's proper diagnostics before placing an implant. So the practitioner should know if there's enough bone available to place an implant, if there's a need of a bone grafting, what will be the angulation of the implant, because a poor diagnostics previously placing the implant is going to make it fail on the long run. Another factor is peri-implantitis, which is a common issue that happens around implants due to poor maintenance. Hygiene at home is crucial, and professional cleanings, so you can keep bacteria around the junction between the bone and the implants. Another factor to consider is occlusal loading. Occlusal means biting. If there's extreme forces taking place on an implant, this implant is going to fail in the long run. There are designs for implants to support one single tooth that you need to consider a certain amount of forces taking place on that spot. There are designs for multiple teeth supported by 2 or more implants, and they're full arches or full jaws designed to be supported by 4 or more implants. So the distribution of forces, it's extremely important. Implants, they're designed to take really well compression forces. That means vertical forces, but they don't take so well the bending forces. So that's why the design of the prosthesis is extremely important to understand how the forces are going to take place on the implant. Prosthetic design. Now, this is extremely important. An implant well placed with a poor design of the prosthetics is going to make it fail as well. So the design should be considered to take certain amount of forces, as I said before, and also to be easily cleaned so the maintenance can happen easily at home. And finally, the patient factors. Well, this is something sometimes the dentist does not have any control about, but every dentist should teach the patient how to maintain an implant at home. Hygiene at home is crucial. So being able to water pick, floss, brush, and visit the dentist regularly so they can clean the prosthesis is extremely important to maintain the good health around an implant. Also, another patient factor to keep an eye on is the health of the patient. If the patient is going to get an implant being totally healthy and young, the patient could get ill down the road. Systemic illnesses, they play an important role against implants, such as diabetes, uncontrolled high blood pressure, high cholesterol. Most of the systemic illnesses that haven't been treated, they will go against dental implants, so you will be losing bone. Also, patients that smoke, abuse of alcohol and drugs, they have a very high chance to lose their implants. So those are the questions you should ask before getting a dental implant. What is the problem with poorly applied immediate loading? First of all, immediate loading means placing the dental prosthesis on top of the implant, screw retain, the very same day you get the dental implant, either in one implant or multiple implants. This can only be done if you get good primary stability. That means you insert the implant and the torque you use to place it is really strong, above 50 newtons. At Mesodental, we really need to diagnose the case before going on for an immediate loading. This is not a standard procedure. It's not one size fits all. It's a procedure that only qualifies for some specific individuals. Obviously, teeth in a day, it's a great marketing tool. Everybody wants to get everything super fast, but it's not real life. Why we use only titanium implants? Titanium has been studied for more than 15 years with great success. So there are a lot of studies with really good outcome. On the other hand, zirconium implants have been around for much shorter time with less data that we can process. And at Mesodental, we don't like to experience our own patients. Titanium implants have been exhaustively documented on scientific literature. So this is why we feel so comfortable about using titanium implants. The questions every patient should ask before getting a dental implant, a lot of them, they only question the brand of the implant. That is important, but it's not the only question you should ask. Besides, there are multiple brands that are well-known with good reputation in long-term studies. Does the practitioner does the diagnostics using a 3D X-ray, such as a CT scan or a cone beam CT? That's the gold standard. How many implants have that practitioner placed over the years? Do they feel so sure about what they're doing that they can give you a written guarantee on their work? What happens if an implant fails? Are you going to be educated on how well maintain an implant? A well-done implant should last over 20 years. A poor-done implant doesn't last a year. Dental implants are one of the most predictable solutions in dentistry today if they're done with the right protocol. If you have questions about your case, if this is the first time you're getting an implant or you have an implant failure already, please visit my link in bio. My team will be happy to schedule a free telephone call with me so we can discuss your case. This is not to sell you anything. It's just to let you understand what happens.